All right, so as it stands right now, we're wasting $1.5 trillion in our healthcare system every single year. That translates to more than $11,000 per household, and you are paying for it. Whether you realize it or not, whether it feels like it or not, you are paying for those unnecessary healthcare costs. You're paying for it with premiums. You're paying for it with deductibles, taxes, co-pays, payroll deductions, etc. Here's another area where you are paying for it that you may not realize. Decreased wage gains. You would likely be reimbursed higher by your employer if they didn't have to spend so much money on healthcare benefits. So that's one key area that people don't realize where this money is going. It's been kind of depressing talking about all of these issues with the healthcare system, why it's so expensive, why our quality is not where it needs to be, and we're going to get to the solutions soon. But today's an especially depressing topic because I got to talk about doctors and our role in making healthcare way too expensive. And it's mostly because the incentives are misaligned. We've talked about this before, but one of the ways that incentives are misaligned is that procedures are reimbursed far higher than preventive care or chronic disease management. Dave Chase is the founder of Health Rosetta. He says this. He says, you are reimbursed far higher for amputating a diabetic patient's leg than you are for effectively managing their diabetes. And he's absolutely right about that. And it's not just this. It is imaging studies. When I was a baby doctor, there was a CEO that came to our provider meeting and explicitly asked us if we would order more MRIs and CAT scans and nuke med studies that quarter because we needed to catch up, because on the business side, it was a bad quarter for them the quarter before. So that was kind of my first taste of the gross business side of medicine. And there are all kinds of things, once again, because of those incentives for reimbursement. Knee replacements that are done when more conservative management would be appropriate. Same thing with spinal surgery. Same thing with C-sections. And a very drastic example, but an example nonetheless, in Dr. Makary's book, The Price We Pay. Once again, this is, in my opinion, the best book out there that describes what is wrong with the healthcare system and how to fix it. Could not recommend it more highly. But in this book, he talks about these cath labs that are around the D.C. area that were raking in up to $100,000 a day of Medicare's money. Well, why was that going on? I mean, all of a sudden there's this boom of stents being placed in the lower extremities of elderly Medicare patients. What was going on? Well, it was a bunch of predatory screening companies going around churches in the Washington, D.C. area, specifically targeting elderly Medicare age patients, performing a screening test that's not even recommended in order to get them into this cath lab to have this very profitable procedure performed. So kind of makes your blood boil a little bit, but that is kind of a drastic example. There are smaller examples of this throughout the country that go on every single day, and it's a big reason that healthcare is far too expensive, and it's something we can definitely do something about, and we should.